Okay, mean arterial pressure is regulated by 5 main things. They're summarized in this slide. It's regulated by cardiac output, which we can understand because we're focused on what's happening in the systemic arteries here. Cardiac output is the amount of blood that's going into the systemic arteries. It makes sense that that would influence the mean arterial pressure. If cardiac output is higher, then it's putting more blood in the arteries, and that should be increasing the pressure. If cardiac output is lower, it's putting less blood into the arteries, and that's going to make mean arterial pressure lower. Recall that cardiac output itself is determined by your heart rate and your stroke volume. So when your body needs to make adjustments to mean arterial pressure, and it's going to do some of that through changing cardiac output, what it's actually going to do is increase the heart rate or change the heart rate and change the stroke volume. If your mean arterial pressure is too low, the heart will respond by increasing heart rate and increasing stroke volume, both of which are going to increase cardiac output and put more blood into the arteries. That's going to raise the mean arterial pressure. If the mean arterial pressure is too high, then cardiac output is adjusted by decreasing heart rate, decreasing stroke volume. That decreases cardiac output, or the amount of blood going into the arteries, and mean arterial pressure will drop. The second thing that regulates mean arterial pressure is called systemic resistance. Systemic resistance is referring to the arterioles here. So remember that resistance is anything that opposes flow. If we adjust the arterioles, either cause them to dilate or constrict, then we are affecting how much blood is being let out of the systemic arteries. We're making it easier for the blood to leave, or we're making it harder for the blood to leave the arteries. So the diameter of our arterioles controls the resistance of the blood to flow out of the arteries. If we make it easier for the blood to leave the arteries, mean arterial pressure will drop. That's when the arterioles are open. If the arterioles constrict, we're making it harder for the blood to leave the arteries, and that's going to cause mean arterial pressure to increase. The third thing that affects mean arterial pressure is blood distribution, or how much blood is in any given part of the circulation. We know from the section on veins that the vast majority of blood in our body is stored in the veins at any given moment of time in time. So veins have the ability to affect the mean arterial pressure by either constricting or dilating. If the veins constrict, then they're not going to hold as much blood as they were before, and that blood has to go somewhere. That blood is then pushed towards the heart, through the heart, into the systemic arteries, passing through the pulmonary circulation first, into the systemic arteries, and increasing the volume of blood in the systemic arteries, which increases mean arterial pressure. If the veins dilate, then that allows them just to hold on to the blood, and mean arterial pressure will be lower. Right? This will become more clear in a future slide. At least that's my hope. The fourth thing that affects mean arterial pressure is arterial volume, or how much space the arteries are giving to the blood inside. This is determined by the diameter of the arteries themselves. If mean arterial pressure is low, if the arteries constrict, if they squeeze back on the blood that's inside them, then that's going to increase the pressure. If mean arterial pressure is high and the arteries relax or dilate, that's going to reduce the mean arterial pressure. So simply by changing the size of the chamber, and it's a long, thin chamber because we're talking about the systemic arteries, but by changing the volume or the space inside the arteries, we can also change mean arterial pressure. This is exactly the same concept that we saw in the heart, where when the ventricles contracted, the volume or the space inside the ventricle became smaller, and that increased the pressure of the blood inside. Um, so we'll take a closer look at this in a moment too. The fifth and final thing that controls mean arterial pressure is blood volume, or how much blood there is in the system overall. Now, your blood volume is determined by how much fluid you take in and how much fluid you lose. Well, fluid loss occurs primarily through urination. Some is lost through sweating and a couple other minor mechanisms we won't go into. But the main mechanism for getting fluid to leave your body is urination. Fluid intake is controlled by you drinking and indirectly through thirst. Thirst is what causes you to drink more. And thirst is something that is produced, that sensation is produced by your brain in the hypothalamus. It takes a much longer time to adjust blood volume than it does to adjust these other four mechanisms. So these are known as the short-term or immediate regulators of mean arterial pressure, whereas adjusting blood volume, either by producing more or less urine, takes longer and is a slow or a long-term response to mean arterial pressure and restoring it. Our bodies use both in order to maintain mean arterial pressure at or around a set point. Let's consider for a moment a situation where someone has a low mean arterial pressure. Perhaps they've been in an accident and they've lost blood. We've stopped the bleeding, but their mean arterial pressure is still too low to supply the organs of the body. And they're not feeling very good right now. We're not going to put any numbers on this dial. We're just going to look to see what happens to this dial, how we get the low mean arterial pressure to increase so that that person is now safe and feeling better. So one at a time. If we increase cardiac output, so here's the left ventricle, here are the systemic arteries that we're concerned about, the pressure in here. If we increase cardiac output, that means that we're putting more blood into the systemic arteries, and that should cause, you can see the blood that just went into the arteries and made them a little bit bigger. That also causes the mean arterial pressure to increase slightly, but the person does not feel all the way better yet. The next thing that happens, or it actually happens at the same time that cardiac output is increased, is that we get what's called systemic vasoconstriction. Now, what that means is that all of the systemic vessels constrict, and each one of those contributes in a different way to increasing the mean arterial pressure. So we're going to look separately at the constriction of the arteries, the arterioles, and the veins, and how that works together with the increased cardiac output to bring mean arterial pressure up. All right, we're going to increase the resistance in the systemic arteries first by causing the arterioles to constrict. Recall that if the arterioles all constrict, that's going to reduce the overall flow through the arterioles, and blood's going to not flow backwards, but simply back up. It's unable to get out of the arteries. It becomes more trapped, or more of it is trapped in the systemic arteries, which is going to increase our mean arterial pressure. So there are the arterioles constricting, And if you watch the artery at the bottom of the screen, you'll see that the blood starts to back up, and there's now more blood in the systemic arteries. That increases our mean arterial pressure. Again, not enough to restore it to normal, but we're getting a little bit better. Constriction of the systemic veins causes the blood to be redistributed around the body. So if you watch the screen, as the veins constrict, that blood that's in the veins, it's not going to flow backwards because we have valves. That blood is being pushed out of the veins into the pulmonary circuit, and it's going to wind up over here in the systemic arteries, where it becomes somewhat trapped because the arterioles aren't letting the blood out as much. So we just got more blood in the systemic arteries because we squeeze the veins, and that's going to bring our mean arterial pressure up, almost close to normal at this point. All of these are immediate or short-term responses. If you've ever had the experience of standing up too quickly after being in a horizontal position for a while and you've gotten lightheaded, you may have also noticed that, particularly if it's a severe response, that you feel cold, or your hands feel cold and your heart is pounding. That is your body responding to the low mean arterial pressure. As soon as you stand up, all the blood that's been sitting there goes to your feet, and your heart's like, wait a minute, I don't have enough blood. So it starts pumping faster to get more blood into the systemic arteries, and all of the vessels constrict in order to force blood into the arteries so that the arteries are delivering enough blood to the organs in need. Now, part of this feels a little counterintuitive, most likely, which is that if we're closing off all the arterioles, how are we delivering any blood? The truth is, we don't close the arterioles completely, or only the arterioles that are serving the less important organs get closed off completely. Arterioles that are serving organs that are critical, like the heart itself, actually stay open in order to ensure that this pressure, this restored pressure, is allowing blood through to serve that organ. Okay, so there's nothing's completely closed. We don't want to stop flow. We just want to squeeze it a little bit so that we influence how much blood is in the arteries at that moment, so we have enough pressure to get the blood where it needs to go. All right. Now, the next part of the response, the next vessel, is constriction of the systemic arteries, changing the volume or the space of the lumen of the arteries themselves. So these arrows represent the arteries constricting as well. And as the arteries constrict on the blood that's trapped inside, it increases the pressure. So you can watch the arteries constrict here, right? And that's going to increase our mean arterial pressure. All right, going back to this counterintuitive part of the puzzle, where it feels like we're shutting off flow. If you've ever had the experience of using a garden hose that doesn't have a nozzle on it, when you open the faucet, the water comes out of the garden hose, but it usually doesn't go very far. The only pressure that's pushing that water is the pressure of the water in the pipes behind it. Now, if you want to water something that's further away from where the water happens to be landing, many of you know that the easiest thing to do is just to put your thumb over the opening of the garden hose. As soon as you block part of the exit for the water. It increases the pressure of the water in the hose behind it and allows that water to spray further. The same idea is happening in the body. Let's say this capillary bed represents your heart, and this capillary bed represents your skeletal muscles. This one represents your stomach, and this one represents your liver. If mean arterial pressure is too low because we've lost blood, the two places that your body will make sure have enough blood, the two organs that are the top priority, are your heart and your skeletal muscles. Now you're probably thinking, why skeletal muscles? I would totally send blood to the brain over the heart, and yes, I would too. I think the brain's more important. But in these situations, the part of the nervous system that is in control, the autonomic nervous system, is this the sympathetic. And the sympathetic nervous system, its response to any danger, whether it's losing blood or preparing to take an exam, is to get you ready to run away. And that means that we need to make sure that the heart and the skeletal muscles have ample blood supply to get you out of danger. So what the circulatory system is essentially doing, if this is our garden hose, is it's putting its thumb over the non-essential organs, the arteries that serve the non-essential organs, or the arterioles that serve them, squeezing those off. That helps to generate the pressure to ensure that the essential organs are getting the blood that they need. Over the long term, the brain sends signals to increase thirst, which helps your body to restore its blood volume, and also decreases urine output. One of the things that happens when someone loses a lot of blood is that their urine output basically stops. And that's because the body is saying, oh, I'm not going to let go of those water molecules right now. I need them in the bloodstream. And so the urine gets extra concentrated, sometimes so much so that no urine is produced at all. There's no fluid leaving the kidneys. So over time, by reducing the urine output and increasing the water intake, the overall blood volume is restored and our mean arterial pressure is restored as well. And then all the vessels can stop with this crazy constriction and your heart can go back to a normal, relaxed beat. There, all fixed. Let's take a look at a flow chart that that helps to put some of these responses together. Let's take the situation where we have a sudden drop in mean arterial pressure. There are two basic mechanisms that are going to be activated. Our fast response, which is cardiovascular, the heart and the vessels, and the slow response, which is the renal compensation. I'm ignoring thirst because that's so varied, whether someone is able to drink or not, what's available to drink or not, how much they drink, what they drink, all of that. So let's assume that thirst and drinking are out of the picture. The slow response that the body's actually in control of is the renal compensation. So blood pressure drops, and the cardiovascular compensation occurs, which consists of systemic vasoconstriction and increased cardiac output. Those two things together increase mean arterial pressure and help to bring the blood pressure back up. In terms of the slow response, which gets started at the exact same time but just takes longer to take effect, the slow response, the renal compensation, what's going to happen is that we're going to decrease the excretion of fluid in the urine. So we're going to hold on to the water instead of allowing it to go into the urine and leave the body. That decreased excretion of fluid in the urine leads to an increased blood volume. And all of these things together restore blood pressure back to normal. The opposite is true if we are dealing with a situation where blood pressure is too high. The mechanisms are the same, they just work in the opposite fashion. So if mean arterial pressure is too high, cardiovascular compensation causes vasodilation, okay, which is going to decrease the pressure. It's going to decrease cardiac output. If we look over here, it's going to increase the excretion of fluid in the urine, get rid of some of that extra blood volume. So reduction in blood volume, and that's going to bring our blood pressure back down to where it should be.